Abnormal uterine bleeding means different aspect we will have to explore. Good evening everybody. I am Dr. Soumitra Kumar, Senior Consultant Obstetrician and Gynecologist, Neotia Bhagirathi Hospital, Rawdon Street. Today I will be discussing about the abnormality of abnormal uterine bleeding. So abnormal uterine bleeding consists of different things. Especially it comes that the excess bleeding, which we call it menorrhagia. If it occurs in a small gap, that is frequently, then we call it polymenorrhea or metrorrhagia. And if there is when unexpected some spotting occurs, that is also we call abnormal uterine bleeding. The most important is menorrhagia. The cause of menorrhagia is that there are several things we must explore. Number one, we will have to think that there may be a pregnancy that is which can happen and which can result by threatened abortion or incomplete abortions. And then we will think of different hormonal pills. Often patients take those pills and suddenly they stop it and they get profuse bleeding. So these are the small things that counts. Then we will be think about the systemic disorders. Systemic disorders means different things, that is a patient is having some coagulation problems, the blood coagulation problem, that patient can develop menorrhagia. Then of patients with CKD, chronic kidney disease, they can also develop this bleeding problem. That is, menorrhagia can occur in those patients. And cirrhotic patients and liver disorders also can result all these problems. So next we got to check all these things. That is, if there is a CKD, obviously we will have to check the coagulation as well as creatinine and all these things. Next we will think about the uterine conditions, the polyp, the endometrial polyp, fibroid or mucus polyp. These things can result bleeding and excess bleeding rather. Then we will be the fibroid, the adenomyosis. That is also very important. To exclude fibroid or adenomyosis, you got to go for MRI, which can differentiate between what is it a fibroid or it is an adenomyosis. So before surgery, we must think over it and just diagnose it properly. Because operating adenomyosis is difficult compared to operating on a fibroid. Then we will be thinking about now it is coming that intrauterine device, which is called Mirena, which levonorgestrel can be liberates from this intrauterine device, and that can prevent the excess bleeding. And every 5 years you got to complete change the things. And embolization, uterine artery embolization, these things also nowadays important, and it can be done by our friends, that is intervention radiologist. Thank you so much for patience hearing. Namaskar.